We're joined right now by a man who has every right to throw a party. Howard Kaufman is the director of the Rush University Cancer Center here in Chicago, the host city of ASCO, but it's also been a big week for you having your first piece of work published in the New England Journal of Medicine. What is that like for a doctor?
I think it feels great, but in part because there's a lot of excitement about the field, and I think this represents the interest that there is now in the whole field of immunotherapy and the potential impact it will have for patients with cancer.
Can you tell us more about it?
Well, we were involved in a large study in melanoma patients looking at a combination of a GP100 peptide vaccine with high-dose interleukin-2 compared to interleukin-2 alone, and we found for the first time there was an improvement in the progression-free survival for patients who got a vaccine and IL-2. And I think this represents a major advance in the field because we could take IL-2, which is an approved therapy for patients with melanoma, and possibly achieve responses in a larger number of patients by combining it with a vaccine.
How big was this study and how did you design it?
So the study had 185 patients, and it was a multi-institutional randomized design. Because it used a peptide vaccine, patients also had to have an HLA typing done, and so they had to be A2, and they were equally divided between getting IL-2 alone or getting the vaccine and IL-2 together. And so it's really one of the largest studies ever done with the peptide and IL-2, and was based on earlier work that was reported by Dr. Steve Rosenberg in a smaller cohort of patients that saw similar results.
So where does this lead you?
Well, I think next this actually opens up the window for doing other combinations with interleukin-2. If this peptide worked, maybe other vaccine approaches would work as well, and we could eventually achieve responses in a larger number of patients. So I think we're going to definitely see more combination therapy, and I think it refocuses interest on the potential clinical application of interleukin-2, which we've had for a while, and I think really understanding how that drug works and how it can really be used to impact a larger number of patients is going to be very important for the near future.
Dr. Kaufman, thanks for sharing some of your exciting news with us, and congratulations on your work. It's nice to see hard effort pay off.
Thank you very much.
Dr. Howard Kaufman, director of the Rush University Cancer Center here in Chicago, Illinois at ASCO 2011.